Right, let's just get straight into it. Welcome to this explainer where we are going to unpack the painful, fascinating, and believe it or not, entirely preventable life cycle of kidney stones. Whether you're a healthcare student, a medical professional, or just someone desperate to avoid one of the most agonizing experiences a human body can actually endure, you are definitely in the right place. Today, we're breaking down the comprehensive, evidence-based management of nephrolithiasis. So here's our roadmap for this explainer. We'll hit anatomy and formation, look at symptoms and emergencies, dive into diagnosis, cover surgical interventions, and finally wrap up with prevention and lifestyle.
All right, Section 1, Anatomy and Formation, the birth of a stone.
To really understand the problem, we first need to look at normal physiology. Think of your kidneys as your body's master filtration system. They're constantly balancing water and removing waste. A kidney stone, or medically speaking, nephrolithiasis or renal calculi, is essentially a chemical traffic jam. It happens when those waste products completely outnumber the water available to dilute them. So, when you're dehydrated, highly concentrated substances like calcium or oxalate literally have nowhere to go and they begin to crystallize. And the crazy thing is, the life cycle of a stone starts completely silently. In steps 1 and 2, the urine concentrates, and these microscopic crystals form. You don't feel a thing. In step 3, they stick together and grow. Still, totally silent. The patient usually has absolutely no idea this is even happening until steps 4 and 5. The stone moves into the narrow ureter, that's the tiny tube connecting the kidney to the bladder, and boom, it creates a roadblock. Pressure builds up inside the kidney, triggering that agonizing pain.
Now here's a really interesting point. Not all stones are created equal. Figuring out the exact type is absolutely crucial for treatment. The vast majority of the time we're talking about calcium oxalate or phosphate stones, which are heavily linked to high salt and high oxalate diets. But the culprits can totally vary. Uric acid stones are tied to acidic urine and gout. Struvite stones are actually driven by recurrent urinary tract infections. And cystine stones, well, they stem from a rare hereditary disorder. So you literally cannot treat a struvite stone the same way you treat a uric acid stone. It's a whole different ballgame.
Moving on to Section 2, Symptoms and Emergencies, when the stone strikes. And this brings us to renal colic. This is that unforgettable hallmark symptom that sends people rushing to the emergency room. We're talking sudden, severe pain in the flank, the side of your back, that just violently shoots down into your groin. Plus, you'll often see intense nausea, a crazy urge to urinate constantly, and hematuria. That's blood in the urine, caused by the stone basically scraping against the delicate lining of your urinary tract. Now, whether you're a patient or a healthcare provider, you absolutely have to know the difference between standard stone pain and a true life-threatening medical emergency. Standard symptoms are awful, for sure. But if you start seeing a fever, chills, confusion, or a complete inability to pee, that means the obstructed kidney is potentially infected. And that combo is a red alert. You need immediate emergency care. So why is it such an emergency? Well, if an obstructing stone and an infection are ignored, things spiral incredibly fast. The backed up urine causes hydronephrosis. Basically, the kidney swells up like a balloon. That stagnant fluid turns into a breeding ground for bacteria, leading to massive kidney infections, acute kidney injury, and eventually sepsis, which is a life-threatening whole-body infection. Ignore it long enough, and it can even cause chronic kidney disease. All right, Section 3, Diagnosis, Finding the Culprit. When a patient comes in, doctors basically have to play detective. They need the exact location, size, and makeup of the stone. The clinical workflow usually kicks off with an initial exam and some history, then moves to blood and urine tests to see how the kidneys are holding up. But the real smoking gun is imaging. The absolute gold standard for adults is the non-contrast CT scan to pinpoint the exact coordinates. For pregnant women and kids, we swap that out for an ultrasound to skip the radiation. And finally, once the stone actually passes, analyzing it tells us exactly what caused the whole shebang to begin with. Now, the good news is, not every stone means you're going under the knife. For smaller ones, we rely on medical expulsive therapy. This means lots of targeted hydration, heavy-duty pain control, and medications like alpha blockers. Tamsulosin is a big one. These meds actually relax the smooth muscles of the ureter. It expands the pathway just a tiny bit, which is often enough to help selected patients pass those smaller stones naturally over a few days or weeks.
Which brings us to Section 4, Surgical Interventions, breaking it down. But what if the stone is just way too big to pass, or the obstruction is causing a dangerously severe infection? Well, modern medicine has this incredible, minimally invasive surgical toolkit. It starts with ESWL. This literally uses sound waves generated from outside the body to shatter the stone into tiny sand-like grains. If that doesn't fit the bill, there's ureteroscopy, where surgeons use a tiny scope and a laser to blast the stone apart directly inside the ureter. And for the really massive or complex stones, they use PCNL. That's a minimally invasive procedure going straight through the back to extract the stone. Pretty amazing stuff, right?
And you might be surprised by this, but after these surgeries, physiotherapy plays an absolutely massive role in recovery. Physical therapists aren't the ones pulling the stones out, obviously, but they're guiding patients through deep breathing exercises to clear out the lungs post-anesthesia. They help with getting mobility back, building up core strength, and just generally promoting healthier habits. It's a complete, holistic approach to getting you back to your normal, healthy life. So this naturally leads us to the #1 question asked by literally every single person who has ever passed a stone. Can they come back? Because trust me, anyone who has experienced this agony wants to make 100% sure it never, ever happens again. Let's answer that in Section 5, Prevention and Lifestyle, Breaking the Cycle.
Okay, the short answer to recurrence is yes, it is extremely common. But the empowering news is that you can absolutely break the cycle with some actionable daily lifestyle tweaks. First off, everyone has got to drastically increase their water intake to keep that urine diluted. You also want to limit excess salt, heavy animal protein, and sugary soft drinks. But wait, here's the kicker, and this surprises a lot of people. Maintain a normal dietary calcium intake. It is a huge myth that you should cut out calcium just because stones are made of it. Actually, cutting calcium can cause more stones. Your body really needs it to bind with oxalate in your gut long before it ever reaches your kidneys.
Just like prevention is tailored to the stone, clinical care is super personalized to the patient. For example, a young adult might just need quick pain relief and time to let it pass. On the flip side, a patient with a fever, that requires an immediate emergency unblocking to prevent sepsis. A pregnant woman has to be assessed with an ultrasound instead of a CT scan to keep the baby safe. And someone who just keeps getting stones over and over, they need a highly specific 24-hour urine collection to map out a custom metabolic prevention plan.
The big, overarching takeaway here is that you are not powerless. Evidence-based clinical guidelines show us time and time again that actively changing your lifestyle dramatically drops your risk of a sequel. Sure, it takes discipline, mostly in the form of practically supergluing a water bottle to your hand all day, but the preventative payoff is absolutely massive.
To wrap things up, proper hydration and early diagnosis really are your best friends here. They help most patients recover completely and significantly reduce the chance of future stones. Kidney stones might just be one of the most agonizing disorders a human can endure, but you are now armed with a clear roadmap of how they form, how they're treated, and most importantly, how to stop them. So armed with all this knowledge, what immediate changes are you going to make today to protect your kidneys tomorrow? Drink your water, stay active, and thanks for joining this explainer on the management of nephrolithiasis.